Today's presentation is on nursing shortages in the hospital setting. I've talked about this in the past, but for today's assignment, we'll look at nursing shortages nationwide, because it is a problem nationwide, as well as I did a Q&A on a cardiac telemetry unit at a local hospital here. Okay, as I mentioned previously, I focused on a cardiac telemetry unit, OPR-MC. The facility has been open since 1978 and currently has 343 beds. They do have a trauma center and they are a certified stroke center. So the culture that I'm focusing on is the nurses, because the issue that we're addressing is a nursing shortage, and we're going to investigate what are these causes of the nursing shortages, some resolutions, and a way to go about solving this shortage. So community culture, because the focus of my topic is nursing shortages, like I said, I'm going to focus on the nurses who work on the floor. So the questions regarding health and lifestyle will be directed towards the nurses, and all answers given are from nurses who work on the floor. So I did a Q&A with nurses who work on the cardiac telemetry currently at OPR-MC. In the following slides, you'll see their answers to the questions. So here are the questions and answers. The first is, what does health mean to you? One nurse stated, health means being able to go about day-to-day activities without any barriers, feeling well mentally and physically. Do you self-diagnose, and who do you go to when you're sick? Another nurse answered, being a nurse, it's hard not to self-diagnose, especially when you work around plenty of health professionals to ask their opinion. Unfortunately, there's this attitude that you have to, quote, suck it up when you're sick and just work through it. I think part of that is you're around people who are so much sicker than you. You almost feel guilty for taking a day off when you're sick. Like, quote, look at this patient. He's had 3 heart attacks and he's up and walking. I should be able to get through a day at work when I don't feel well. Next question, is health a right? Does your lifestyle have anything to do with health? One nurse answered, I think everyone should be able to get the care that they need. I try to be healthy, but it's not always easy with the hours I work and taking care of my family. Next question, what is the culture of health and nurses? For example, do you think culture is changing or is it stagnant? I really think that there is pressure to try and work no matter how terrible you feel. I have heard people talk negatively about nurses who call in when they are sick and make it sound like they are just being, quote, wusses and can't hack it. It makes you feel like when you are actually sick and shouldn't be at work, that you will be judged if you don't come in. I feel like this is a bigger deal in the healthcare world because we deal with really sick patients every day. It's like we aren't allowed to take a day off when we are sick because we aren't as bad as our patients. Also, there's a culture that you just expect to be short-staffed. Most days we are lucky if we have any techs, and usually we are down a nurse as well. I don't think this culture is changing, but it needs to. So real quickly, I'm just going to pause here to just kind of point out, you already start to see a trend with the answers and the questions where like the nurses are obviously feeling that there's not there's no real self-care, and if they do feel like they need to take self-care, they feel like they're going to be judged. And then just the expectation that they're just going to be always short-staffed and just not to expect to have a full staff. Okay, so we'll move on to the next questions. So I asked, do you know what OPR-MC missions and values are? So, every facility has their missions and values, and depending on where you work, they either, really want you to know what those missions are, or they may not focus on it really at all, but either way, every facility has a mission and value. So I asked, the answer, it was, the mission is above all else, we are committed to the care and improvement of human life. The nurse said, I actually know this because we are quizzed on this weekly in morning huddle. When administration does rounds, they ask us what our mission is. There's a lot of pressure to have this memorized in case administration asks us. Honestly, I don't know the rest of the values. It's hard enough to remember everything else. So in this case, this facility really does want the employees to know what their mission is. I guess they get quizzed on it in huddles. I'm not really sure what the purpose of that is, but regardless, it is something that they do there. Do you think OPR-MC facility operations reflect the culture in the community? One nurse answered, I think they try to. Don't get me wrong, I think they really want to improve the quality of care, but I think there is a divide between the people who provide care and administration. We are drowning. Do you think OPR-MC's mission is communicated in daily nursing practice and patient care? One nurse answered, I know for myself, I really am committed to try and make my patients feel better and take the best care that I can. I think she meant to say and give the best care that I can, but it is hard. I don't feel I have the time when I have so many patients to take care of. Also, I don't think it's just OPRMC. I've heard it's like this in every hospital. So even though this Q&A was on a very busy unit that was kind of notorious for having high turnover rates because of the high acuity of patients, overall stress, there was high turnover rate on this unit in particular, but this is not unique to OPRMC. This happens everywhere. I'd have to agree with that nurse just because I have so many nursing friends that have worked at all facilities all over, and it's the same story you hear over and over again. We don't have enough staffing. We've got too many patients to nurse ratio. I don't feel like I can take care of my patients and things like that, which can lead to burnout, which is one of the causes of nursing shortages. So we'll move on. The nursing shortage issue. The nursing profession continues to face shortages due to lack of potential educators, high turnover, and an equitable distribution of the workforce. That's kind of referencing high patient to nurse ratio there. The causes related to the nursing shortage are numerous and issues of concern. According to the American Nurses Association, there will be more registered nurse jobs available through 2022 than any other profession in the United States. The U.S. Bureau of Labor Statistics projects 1.1 million additional nurses, are needed to avoid a further shortage. Employment opportunities for nurses are projected to grow at a faster rate, 15%, than all other occupations from 2016 through 2026, and that's from the U.S. Bureau of Labor Statistics. So I wanted to do a little digging and see, do some research on what's the cause of the shortage, what are the factors that led to this shortage. And like I mentioned previously, there's a couple of factors. An aging population is one of them. Currently, the U.S. has the highest number of Americans over the age of 65 than any other time in history. The aging workforce. There are currently approximately 1 million registered nurses older than 50 years, meaning that 1/3 of the workforce could be at retirement age in the next 10 to 15 years. Nurse burnout. Some nurses graduate and start working and then determine the profession is not what they thought it would be. I hear this a lot from my fellow classmates when we graduated nursing school and started working in a hospital, and they start to get burnt out. Turnover in nursing seems to be leveling off, but only after years of steady climbing in rates. Currently, the national average for turnover rates is 8.8 to 37%, so that's pretty high. Nurses who have left the profession, a major contributing factor to the under-availability of bedside nurses, often cite poor work environment coupled with poor compensation as a primary motivation to leave nursing. And I think that's especially true with bedside nursing in the hospital. Other factors, career and family. Adding to the shortage problem is the fact that nursing is still majority female, and often during childbearing years, nurses will cut back or leave the profession altogether to help care for their family. Another less common but another factor is violence in the healthcare setting. Healthcare workers are at high risk of violence in all parts of the world, with between 8% and 38% suffering from some sort of violence in their careers. I'm a numbers person, so I really like to have visuals with my statistics. So this is just a graph that's representing supply and demand here of nurses. So this is a projection for 2020, which is next year already, believe it or not. So the prediction is that U.S. to lack 808,000 nurses by 2020. So this is kind of where we're at. You can see from 2000 to 2020, and you can see the demand going up as the supply goes down. And here's another projection. It's same year, but it's saying more, it'll be close to 1 million rather than the previous graph, which estimated it around 800,000. So, I mean, they're pretty similar, and the trend's the same. You can see the supply going down as the demand goes up. So, analyzing the issue, there is currently little research on how many nurses are actually needed to provide quality care in a cost-effective manner to meet the needs of the U.S. population. It is therefore difficult to measure the magnitude of a shortage or even to say with empirical certainty that a shortage exists. So, I mean, there's obviously some people that aren't completely sold on this projection, because you're guessing what the demand's going to be. So it's not going to be 100% accurate, but we can kind of know that, well, with the aging population and the nurses that are retiring, that there is definitely going to be a demand there. So what are the impacts caused by nursing shortages? I mentioned before a few times that it leads to nurse burnout and staffing ratios. So with the nursing shortage, the staffing ratio increases, causing more burnout and turnover. It leads to medication errors. There's a higher rate of medication errors when there is a higher nurse to patient ratio. Okay, higher morbidity and mortality rates because more mistakes are being made. Again, nurse burnout, as I mentioned. And then, unfortunately, I was not able to find any services or programs to assist nurses with the feeling of burnout. I did research to find out, are there support groups? Are there is there something out there that can kind of help us nurses? You can find some groups on Facebook, like local groups. There are some of those that you can join, and that kind of acts as a sounding board, and you could probably find some support through them. But there wasn't anything official. There was nothing that I could find anyway, and maybe you guys can tell me about some programs that maybe you were able to find, but I was not. Now, within OPRMC, the hospital that I did the Q&A at, they do offer several committees that you can serve on to help you feel more included and part of the team. Which is nice, but it's not really like a support group. It's more or less like, hey, if you join this committee, there's certain perks. You might get moved up the ladder more quickly. You might be considered for charge nurse or other positions. So it's more like a way to get in and move up, not a place to go for support necessarily. So analyzing the issue at our local hospital here, we've got the strengths on the left side and the weaknesses on the right side here. So the strengths of the cardiac telemetry unit at OPRMC, they do have new management that I've been told is focusing on getting approval for agency nurses to start immediately. They already have agency nurses currently because there is such a high turnover rate on that unit. But apparently they're approving more agency nurses so that they're not coming to work without any techs and short like 2 nurses, So they are aware of the issue and they're focusing on that. Weekly recognitions given to nurses in huddle. So in the mornings, actually it's not, I believe it's every morning actually. But I think what they do is they gather compliments from patients and other staff members, and then they gather at the end of the week, and then in the morning huddles, they'll recognize those nurses, which makes people feel valued. And it makes them feel like all their hard work is paying off and it's not just for nothing, And then they have a new lunch buddy system being started. So before there was no person to go to if you needed to take your lunch break. You were just on your own and trying to figure out when you could make time to grab lunch. And what ended up happening was people weren't able to get lunches, so they're working, 13, 14 hours without a break. So that's not good. So they are working on those issues. So I see those as strengths. The weaknesses, they're frequent, unfortunately, even with all these efforts, they are still frequently understaffed. They do have a high turnover rate due to acuity of patients and high patient to nurse ratio. That's supposed to be ratio. The acuity of the patients on the cardiac telemetry is quite high because of the nature of their illnesses. And so they tend to need a lot more care. They tend to have more medications that they have to have. They're not as independent. Most of them are fall risks, and so they've got the bed alarms on, and how sensitive those alarms can be. So there's alarms going off constantly that causes alarm fatigue. And then the patient assignments are not consistent. I'm being told that instead of getting, your 6 patients, right in a row, so they're all right next together, they've got patients that are, one patient's down one end of the hall, another patient's on the other end of the hall, another, it's not convenient. And I know they have to do that based on acuity, but they might be able to maybe kind of figure out a way where they can move patients around in a way that makes sense so that you're not, having to run back and forth. So those are things that they could still be working on. And moving on to methodology, as far as solving this issue, what kind of way would I go about it as far as a research project goes? So first you have to look at what kind of question you're asking. So the question I'm asking is, well, why is there a nursing shortage? And the second part of that is, what can we do to solve this nursing shortage, right? So what type of data will I need to collect to answer the question? So I would need to find the cause of the nursing shortage, as well as looking at numbers. So projection of shortages, which we kind of already mentioned with those statistics earlier. the estimated number of needs. So how many nurses are we going to need, and what is the supply and demand? So we've kind of already touched base on that. But a part of that reason is nurse burnout. So you kind of have to look at what's causing the nurse burnout as well. So you've got the number side of things, which would be the quantitative, right? But then you'd have the qualitative part as well, because you're going to be surveying people about, how, happiness in their jobs and what's causing the burnout. So that's going to be more of a qualitative type of research. So I decided that a mixed method of quantitative and qualitative would be best. And after I decided that and I did a little bit more research, I actually found out that mixed methods research, where quantitative and qualitative methods are combined, is increasingly recognized as valuable because it can potentially capitalize on the respective strengths of quantitative and qualitative approaches. I also found out that mixed methods research has been widely used within healthcare research, which I did not know. So it's kind of interesting. I came to the conclusion that a mixed method would be best. And then when I did a little bit more research on mixed methods, I found out that that was a preferred method actually in healthcare research. So there you go. So here's a big question. How are we going to fund this? Well, first, how are we going to fund the research, right? Because someone's got to pay people to do the research. And then how are we going to fund this issue? How are we going to fix it? Because, obviously it's going to take some money. We need more nurses. So how do we go about that? And we also need to help prevent nurse burnout. And it kind of comes full circle. So just to address the issue at OPRMC, I said it became apparent to me that funding wasn't the issue, as they were willing to spend the money to hire agency nurses, which is true. Agency nurses are really expensive. And so if they've got the funding to pay, twice the amount, and they are willing to pay as many nurses as it takes to get them fully staffed, then at this point, with them specifically, it's probably not a funding issue. It's a issue of what can we do to prevent burnout. Because as you saw in the Q&As, the nurses, the culture was that they're overworked, and they're not getting breaks, and so now management's saying, okay, well, we're going to bring in all the agency nurses, we're going to be up to staffed, but if there's still a turnover rate, then what's going on there? Okay, so it's not just the nurse to patient ratio at that point. They have to look at the other reasons that are causing this. All right, so with them, I don't think it's necessarily funding. They have to look at how can we support our nurses and how can we prevent nurse burnout. Nationwide, I said you can't just utilize nurse agencies, right? Because you're not solving a shortage if you're just dispersing nurses all over the place. Because nurse agencies, travel nurse agencies, they're not creating more nurses. They're just taking a nurse from, California and putting that nurse in New York. Well, that's not solving the nurse shortage problem, right? So you have to get to the root causes, which are the lack of educators and the need for more nursing colleges, nurse burnout, and high turnover rate. We need more nursing educators. We need more nursing colleges. We need more spaces in nursing colleges to produce more nurses, right? So how do we get more educators? How do we get more spaces in colleges? Well, money, right? So that's where the funding comes in. So I was thinking the funding to solve that issue nationwide could come from federal grants. Now, I am not a grant writer, and I am no expert in grants, but I do feel that since this ties into healthcare, now I know we don't have socialized healthcare, and it's privatized, but at some point we do have to realize that we do have to take care of our sick and our elderly and, everybody. It's an issue that can't be ignored. So I do think the federal government would be willing to help fund a project that would produce more educators in more schools, and as well as recruitment efforts. I don't know what that would look like necessarily, but I do think that there could be some incentives that could be really appealing to people. I know already if you work in the military that you can go to tech schools, like radiology tech school can be paid for. So maybe there could be an incentive similar to that, We'll see. But that was my suggestion, would be to look at grants to entice people to become educators and encourage people to become teachers. Okay. Now, recommendations to nursing shortages. So this is going to address issues of retaining nurses and trying to keep them from leaving the profession. So some facilities, clinics, and hospitals are implementing strategies like a clinical recognition program and nurse participation in collaborative governance committees. These initiatives are two major factors in making nurses feel that they are receiving recognitions and making their voices heard. Kind of touched base on that earlier with OPRMC. They do have some committees, and I think a lot of those purpose of those committees is to make people feel like they're included and that they're important, and that their employer values them. Sign-on bonuses are good to attract nurses in generally, and then keep them there, because usually you're contracted if you have a sign-on bonus. Not a good long-term solution, but it could be a good short-term solution. Continue to use agency nurses to increase patient-to-nurse staff ratio. Again, that doesn't necessarily solve the shortage. You're just kind of dispersing there, but anyway, employees today seek more personal time versus financial compensation. So offering additional PTO or paid holidays would attract more persons to nursing. I completely agree with that. You have a more comprehensive benefit package with more PTO. I think people would be more willing to stick around. Work-life balance is really important. So employers are increasingly offering services to reduce the stress of managing professional and personal lives. These services include child and elder care, dry cleaning, house cleaning, on-site full-service banking, and yard care. I have yet to find a facility that offers those things, but apparently they exist, or at least according to my research they do. So kudos to those employers that are offering those extra perks to keep their employees happy. Okay, nurses need to feel valued. Increased funding for education needs both local and national attention. Nurses also shape the impression that others have about the profession. For instance, they may discourage their own children regarding nursing as a career choice. Nurses frequently report that they do not encourage their own children to consider nursing as a career. So again, burnout has some secondary effects here where, you're burnt out, but let's say you're in your 50s and you're like, you know what, I'm just going to stick it out, but then you've got an adult child that's in college and trying to figure out what they want to do, and they say, Mom, I think I'm going to become a nurse, and you say, absolutely not, it is terrible, don't do it. So apparently this is happening, and I didn't realize this until I did more research on this subject, but yeah, apparently nurses are discouraging their children to pursue the career, so that's not helping the issue either. As simple as it sounds, all nurses need to be aware of the way in which they discuss their work in public. So talking negatively about being a nurse in public, I think we're all guilty of it. You've had a rough day and you're, with another nursing friend, and you're just venting, and you don't realize who's standing around and listening. And maybe someone was thinking about becoming a nurse, and then they overheard your conversation and decided, well, never mind, that doesn't sound so great. So being mindful of how you talk about your profession. And focusing on hiring nursing educators and expanding nursing programs is key to solving the nationwide issue of nurse shortages. So that's a big part of it as well. Thanks for listening to my presentation. These are my references here. If you have any questions or comments, feel free to reach out to me. I do think this is a pretty critical issue that we need to address, which is why I've done more than one project on this subject. So thanks for listening, guys.